Finally, an alternative to prednisone for people with PMR, polymyalgia rheumatica. There aren't a lot of conditions where there are no alternatives. And traditionally, there has been nothing else people with PMR could turn to. It was either prednisone for a year or more, or suffer and be unable to even lift a cup to your mouth because your shoulders hurt so bad. So, what's a PMR patient to do? Well, brand new information was just published in the best scientific journal in the world, the Journal of the American Medical Association. And it has this fantastic news that there might be a new alternative to prednisone. People who have been stuck on prednisone for a long time might just wish for any alternative. So let's find out. Is this for you if you have PMR and you're stuck on prednisone? Well, let me tell you what they did in the study, and then at the end, I'll explain who this is probably for. So when they signed people up to participate in this trial, they called it the semaphore trial. They had to be at least 50 years old. And these are basically to make sure that people actually have PMR and not some other condition causing pain that's similar. So they had to be 50 years old. Nobody has PMR unless they're 50 years old or greater. And that's just one of the diagnostic criteria. You might be younger than that and be feeling like you do, but according to the doctors, you don't. You had to have a CRP, which stands for C-reactive protein, of greater than 10. And that's a blood marker of inflammation in your body. And so they want to make sure you actually have inflammation. An ESR, that's called an erythrocyte sedimentation rate. It's another marker of inflammation in your body of at least 20. And have taken prednisone of somewhere between 12 and 25 milligrams per day and shown worsening of your disease, which they called increased disease activity when you tried to taper. So if you've been taking 20 milligrams every day and you try to go down to 15 milligrams and your disease comes back, that's what they're referring to. If you suddenly, like, you were able to have relief of your joint, like not your joint necessarily, your shoulder and neck pain, you might have it in other regions of your body. You are suddenly able to lift your own cup to your mouth, latch your own bra, all of these activities that you weren't able to do when your PMR is high, and the prednisone worked, and then they lower the dose and suddenly that pain is coming back. That's what they're looking for. And they gave people either treatment or placebo. So placebo was the exact same like medicine, looked like the exact same medicine, but it actually had nothing in it. After those 24 weeks of getting an infusion of what's called Tocilizumab, or the brand name is Actemra, A-C-T-E-M-R-A, they would get an infusion every 4 weeks, so a total of 6 doses. And the doctors were allowed to start tapering the prednisone after week 8. So you'd have to have at least 2 infusions. Actually, I guess that would be 3 infusions. So on week 0, week 4, and week 8, and then you could start tapering the prednisone. And the goal was to find out who was still suffering enough to keep their prednisone dose up, like who were able to actually decrease their prednisone dose. And so they found that 49%, almost 50%, almost half of the people who used the treatment, who used the Actemra infusions, the real drug, were able to be off steroids. Like half of the people are able to get off of prednisone. That is super awesome. What about the people on placebo? 19.6% of people who were taking the placebo version were able to get off of steroids after the 24 weeks of the study. So that's pretty typical for PMR. Like some people are stuck on prednisone for 3 to 5 years. Other people are able to get off within a year, and maybe these people had been on for 6 months and now their year had run out. And so they were able to get off of prednisone anyway. So that's should be really great news, right? Like everybody should just take Actemra who's taking prednisone for their PMR, right? Well, we have to first talk about a few things, like, for example, adverse drug events or side effects to the Actemra. And what they noticed was there were increased infection rates among people who received Actemra/Tocilizumab, but it wasn't that much more than placebo. So people who had placebo, 39% of those people had an infection, and 47% of people who were taking the drug got it. So 39 versus 47, a lot of people got sick at some point, right? Prednisone causes immunosuppression, people get sick. Actemra causes immunosuppression, people get sick. Everybody's getting sick. So if your big concern is having an infection, then Actemra is not right for you. The real kicker, though, was when they surveyed people and said, hey, is this worth it? Like, did this change your life? Did it improve your quality of life? And when they surveyed people with PMR who got the treatment versus people who with PMR who didn't get the treatment, there was no difference in their quality of life. So people who were still stuck on prednisone didn't see their lives as much better than people who were not stuck on prednisone but were having to take Actemra. So I guess the real thing is pick your poison. You really hate the side effects of prednisone? Do you hate having to take a drug every day? Do you hate the risks for osteoporosis and muscle loss and the weight gain? Because that's the poison you're going to get from the prednisone. Or would you rather every 4 weeks have to go get an infusion at an infusion clinic and potentially feel yucky after and have a slightly increased risk for infection? It's up to you. It's between you and your doctor. Plus, the Actemra is like thousands and thousands, tens of thousands of dollars each month. So if you have really awesome insurance and you really hate prednisone and you've been stuck on it a long time, Actemra is for you. If your insurance doesn't pay very well and, you kind of are okay with the prednisone, it's better than being stuck, unable to pull your own pants up, then stick with the prednisone. You choose. Pick your poison. There's no perfect alternative yet for prednisone, but at least there is an alternative to choose from because they've tried like everything. They've tried high-dose vitamin D. They've tried rheumatoid arthritis drugs like hydroxychloroquine and other immunosuppressants, and none of them have ever shown any benefit. So if you're taking prednisone for PMR and you're like, isn't there anything else? There is something else. And it's probably going to be FDA approved for this indication, but it's not that much better, at least according to the people who actually took it. So let's keep those doctors researching for even more better alternatives to prednisone. If you are suffering the side effects of prednisone and you're wondering, is there anything I can do to counteract the side effects? You need to download my prednisone checklist. Just click the link below and it'll give you the top 7 mistakes people on prednisone make and what you can do about them, plus the top 15 things that people wish they'd known and how to cope with side effects. So just download the checklist below and I will send you an email in your inbox today. Signing off as Dr. Megan, your prednisone pharmacist.